overlook lid disease and staph overpopulation, we end up with this triple whammy, and I think we sometimes really overlook it. So first, the patient is producing insufficient meibum because their glands are obstructed. Second, they have overpopulation of staph, which produces lipase, breaks down the meibum, produces soaps, and then the soaps further break down the lipid and further destabilize the tear film. And I think sometimes we have failures with some of the more advanced technology that we use and frustrated patients because we overlook that very, very simple fact. And I agree that can go on well beyond that and undermine contact lens wear and everything else. But to me, that's one of the key elements in the equation of managing the dry eye patient.
Art, I think you make a really good point, and that's why so much of ocular surface disease actually involves MGD. It's not saying that it's the only part of the dry eye disease, but whatever the primary etiology actually is, MGD is a component that happens as a result. If it's that there is an inflammatory aqueous deficient component, what is it doing? It's resting. All that inflammatory mediators are resting on the inferior lid margin. That inflammation is then going to cause what? That posterior blepharitis, that inflammation to the lids, which then causes that cycle of destruction to the architecture of the meibomian glands. But a bigger part is going to be the actual congestion that is happening from just modern risk factors. We're not blinking. Contact lens wearers, very common. If we're staring at video display terminals, computers, more than 4 hours a day, put you at even a higher increased risk. The anterior blepharitis patients, right, that bacterial overgrowth, that again leads to posterior lid margin spillover and disease with the lipases and everything that Eric so eloquently stated. But all of that in combination, that is why MGD and meibomian gland health suffers when there is dry eye from whatever the cause that may be the primary cause to start with.